Hi everybody and welcome to the BMS podcast. We all have different perspectives on health, disease and illness that are all shaped by our socio-cultural environment. The aim of this podcast is to raise awareness on different socio-cultural belief systems toward health and promote culturally sensitive approaches in a Western secular environment. Hi, everybody, and welcome to this third episode of the BMS podcast. Today is a very important podcast for us because BMS stands for Body, Mind, Spirit, which is rooted in Indigenous medicine. And this is something quite difficult to understand for many people here in the Western world, especially here in Europe. So we are very happy to have one people who is self-identified as a person from the First Nation in Canada. So Jaris is a pharmacist, and I will let him introduce himself.
Thank you so much for that. And thank you for having me. So my name is Jaris, just like the city Paris, but with a J. And my last name, Swidrovich, is actually a Ukrainian name, and that comes from my father's side, who's fully Ukrainian. But on my mother's side, I am Saulteaux. It's called Saulteaux, which is kind of like Ojibwe or Anishinaabe, if people have heard of those kinds of First Nations people before. My reserve is called Yellow Quill First Nation, and that's where my family is from, which is on Treaty 4 territory in Saskatchewan, Canada. I am a pharmacist. I studied in both Saskatchewan and Ontario. I did a Bachelor of Science in Pharmacy in Saskatoon, a Doctor of Pharmacy or PharmD at the University of Toronto, and a PhD in education at the University of Saskatchewan. My PhD in education actually connects a lot to the topic here today. I studied Indigenous people's experiences with pharmacy education in Canada. I myself also am a two-spirit person. I am a queer person. I have a non-visible disability, and I use he, him, and they, them pronouns. And then currently, I am an assistant professor in the teaching stream at the University of Toronto's Leslie Dan Faculty of Pharmacy in Toronto, Ontario, Canada.
Okay, great. Thank you for being with us today. So I've learned that we have around 6% of the population in the world is called Indigenous. How would you define Indigenous people compared to other people?
Yeah, so Indigenous, kind of like the word Aboriginal, and sometimes both of those are used interchangeably, essentially mean the first peoples of that particular land. So someone might be indigenous to a certain area. Often we even refer to plants and animals as being indigenous to a particular area because that's their home, that's their homeland, that's their home territory. Their whole lineage is traced to that particular land. So in the context of what we now call Canada, Indigenous peoples in Canada refer to First Nations people. Indigenous also refers to Métis people, and Indigenous refers to Inuit in Canada too. So Inuit are the first peoples of the North, and Inuit is actually a plural term that means people. So referring to a single Inuit person, you would say Inuk or I-N-U-K.
Okay.
Of those three groups of First Nations, Métis, and Inuit, in the Canadian context, I am a First Nations person. Sometimes folks will think that I'm Métis because my dad is white and European ancestry, but that's just not the way it works in Canada as per something called the Indian Act of Canada that describes who I am as a status First Nations person. So my ancestors were the first peoples of this land.
Okay, great. Thanks for all this information. I wasn't aware of all those details. So talking about healthcare, maybe you can talk about Indigenous tradition, what can be talked in public, obviously, and how and why did you decide to jump into the more, I would say, the Western healthcare? Did you have any expectation for such career?
Good question. So I grew up in a very Western way, I'll say. In Canada, many things happened to First Nations peoples here in Canada, but one of the many things that happened was called the 60s scoop. So that took place in the 1960s until later in the 1980s. And what the 60s scoop refers to is when Indigenous children were scooped out of their homes or taken out of their homes and put into essentially white foster care. So this applied to my mother and all of her siblings. So my mom, as she was growing up, was taken forcibly away from her mother and family and put into white foster care because the government of Canada felt that Indigenous children would be better off with white parents and white families versus their own families. So my mom lived through a series of foster homes and experienced all kinds of abuse. And you mentioned body, mind, spirit. Well, she experienced abuse of the body, of the mind, and the spirit too in each of these foster homes. So because of what being Indigenous meant to my mom, it actually ended up hurting her, right? Because if she wasn't Indigenous, that wouldn't have happened to her. These were government policies that only applied to Indigenous peoples. So my mom wasn't able to grow up with much of her own family, her language, her Indigenous traditions, Indigenous medicines and practices and ceremonies, etc. So she didn't have much of that to pass on to me. And in fact, she quite deliberately didn't want to anyway, because she saw what being Indigenous did to her, or what that meant for her. So my worldview for much of my upbringing was primarily from a Western context. Although I've always known who I was and who I am, I didn't have the resources available to me to truly understand and to be fully integrated in terms of being an Indigenous person and seeing the world through an Indigenous lens. So when it came to applying to post-secondary programs, I wasn't at first even considering indigeneity in my selection of disciplines, and kind of just happened upon pharmacy. It was a little bit of a mistake actually initially, and then, well, here I am years later as a pharmacist. But certainly as time went on throughout my pharmacy training and practice experience, my indigeneity has grown in a way that I do see the world primarily through an Indigenous lens, while also having that Western lens appreciation and worldview too, because that's how I grew up. And the more and more time I spend in this profession, the more obvious and apparent those tensions appear between Western and Indigenous worldview, whether that's about medicines and medications used in healthcare, or even practices. I know that in pharmacy school and other Western-based health professions don't talk at all, or maybe just a very little bit, about the spirit, for example, and spirituality and religion and what that might mean for someone's wellness and healing and healthcare. But I know as an Indigenous person how valuable our traditions are, whether that's dancing, speaking our language, participating in ceremony, sweat lodge, a pipe ceremony, certainly very many other ceremonies, and what that means for people's wellness as an individual, as a family, as a community. But you don't see that being taught or practiced or recommended from Western trained health professionals. My great-grandfather was a traditional Indigenous medicine man. And so it's kind of neat to see how a few generations later, I'm a very Western medicine man as a pharmacist. But I absolutely carry that appreciation of Indigenous practices and Indigenous medicines. Although I'm not a trained medicine person, I will never, promote, or not promote's the wrong word, suggest or prescribe, let's say, a certain Indigenous medicine, because that's not my training. My training is a Western pharmacy, but I will absolutely hold space and make space for Indigenous medicines and practices.
Yeah, I'm really sorry to hear what happened to your mother and the way she apparently tried to protect you by not passing you the tradition you deserve. And I heard about that, but I thought it was a long time ago. So I'm really surprised. I'm not going to ask your age, but I'm surprised it was quite the case recently in Western. So, but in this Western healthcare environment, you are now able to identify yourself as an Indigenous people. So something has changed, at least from my perspective in Europe. I don't know, day by day, is that easier for you, especially when you said you're the first who has decided to reconnect with your roots. So something happened. Law have changed, for example, to protect more First Nation people.
Yeah, I think that we are on a path of doing better in Canada. There's still a very, very long way to go. We can't undo hundreds of years of colonialism in a matter of a couple of years. So it's going to take a very long time for Indigenous resurgence to be fully realized. But one of the biggest pieces that has catalyzed the progression to doing better in Canada was the Truth and Reconciliation Commission of Canada. And that Truth and Reconciliation Commission, or TRC, they published 94 calls to action in late 2015. And those 94 calls to action have really existed as a framework for every person in Canada, every organization, every discipline, in terms of what they can do to do better and to make this nation a better place for the First Peoples of this land. And what you mentioned too about, having something take place quite a long time ago, the 60s scoop was separate from the residential school system, but the residential schools were still operating until 1996 in Canada. So you didn't ask for my age, but I'll tell you, I'm 36 or turning 37 in August. So I was born in 1986. And some of my friends who are exactly my age and even younger than me also attended residential schools because they were still operating until 1996. And of course, the day that a residential school closes, it doesn't mean that the harm is done right then and there, right? So we absolutely have ongoing legacy effects and intergenerational trauma from those experiences. So yeah, a lot of room to grow, but the Truth and Reconciliation Commission of Canada was entirely an initiative of survivors of that residential school system. It was not a government entity or a government report or a government doing. It was a grassroots initiative, a grassroots commission of survivors of the residential school system. And I think that Canada, by and large, is really starting to listen to them and acting on those 94 calls to action.
Or maybe I didn't tell you, but I, as you know, I heard about you and your work. That was last year. We were just finalizing our paper on body, mind, spirit, osteopathic tenet, and I saw the title of your webinar, and I said to myself, "Oh my gosh, it was." It's very provocative title, at least for me, just indigenizing Western healthcare and decolonizing Western healthcare. So I was very curious. And then I saw you, very peaceful, very conscious of this, a lot of conscious of this legacy, and you, as a voice speaker for all those people, you would be entitled to be very angry, and I found the exact opposite, very calm and very describing. So I'd like to thank you, because it helped me a lot, because in our profession we are also facing, I would say, a polite ignorance. Many colleagues know that we are publishing, especially on this spiritual dimension in healthcare, but as they can't relate to something they are familiar to, they can't give sense to this work. So my next question would be, to what extent are you allowed, because you are within the Western establishment, healthcare, to what extent are you allowed to talk about indigenous belief system regarding health, disease, and illness?
Yeah, I think that to a massive extent, I can talk about it, but again, not from the point of view where I practice those things. So what I mean by that is I'm not an elder, I'm not a traditional medicine man, but I am an Indigenous person who is also a pharmacist. So I can certainly share with people how I integrate both the worldviews and both practices, and work with patients and clients and families and communities for how they too can operate their own health management through both Western and Indigenous practices and medicines, and how they can be blended. I think that a lot of institutions and people and hospitals and post-secondary schools have asked me and some others like me to share some of that content with their students and staff and faculty and practitioners, members of the public, which is really wonderful. But also sometimes I wonder if I or someone like me is only asked because I live within the Western system, right? And I'm not just solely one or the other. I think that there would be more tension or pushback or resistance if I wasn't a pharmacist and wasn't a Western trained person. But the fact that I am, and also am an Indigenous person with a family lineage of traditional medicine people, I think that that's opened some doors, not just for me, but opened some doors for our ways as Indigenous peoples to be heard about and listened to and hopefully understood in these Western circles, whether they're academic or professional circles or otherwise. So yeah, there's a very big extent to which I'm able to talk about anything and everything Indigenous as it relates to healthcare. But like I said, and I'll just repeat again, that I don't have the training to go recommend a particular medicine or practice, but I can certainly help folks blend each worldview together.
Okay, and do you have any on the, I would say, on the opposite side, Western people without any indigenous lineage who are interested in, and who for them receiving such indigenous treatment would make more sense for them? Is it something common in Canada, for example?
I mean, I guess I don't have a proportion in my mind of how many folks that would apply to, but certainly, yes, I know many people who are not Indigenous but choose to practice Indigenous ceremony, for example, or take or use or plant or harvest Indigenous medicines. And I think that's really great. I think there's a lot to be learned from each knowledge system. I don't think that anywhere in the world or universe that one knowledge system is considered the best and others are just kind of there as an addition. I see us all occupying a seat at the overall table, right? So I see Western medicine and practices as a single chair around the table, and I see Indigenous medicines and practices as another single chair around the table, traditional Chinese medicine as another chair, and so on and so forth. So we all have something to learn from each other, and I think that as time has moved on, and each knowledge system and each practice has evolved, there's even more than before for us to borrow from each other and partner together and use both systems. I know that for me, and even for my mother in her cancer journey, my mother absolutely used and was given, Western chemotherapy treatment. But she also used traditional Indigenous medicines and practices, and some ceremony. We did smudge. It's called smudging. I won't go into detail, but she smudged a lot, and we smudged with her. It's another form of ceremony, and you burn various plant medicines as part of that ceremony. So I think there's really beautiful ways to incorporate both, and whether you're Indigenous or non-Indigenous, there's a lot there for you, whether it's Western or Indigenous practices and medicines. All of it is out there for you to take what you want and leave what you don't want.
No, thanks for this very inspiring perspective. But I know you have published a couple of papers that will put in bio, and sometimes you talk about structural racism or structural colonialism. Even for me, who is a non-English native, those are strong words. What is, how would you define those aspects?
Yeah.
I assume, excuse me, I assume those are conscious or unconscious.
Yeah. So something like structural racism is when systems, or the structure of systems, and by system I mean, well, like a university, I mean a hospital, I mean the country of Canada. So the system and structure of those entities is inherently racist. So the creation and ongoing management and delivery of such systems and programs are not coming from Indigenous peoples or Indigenous worldview. One particular example that I will share within a healthcare context, looking at a hospital. So of course, I, as an Indigenous pharmacist, I was working at a hospital in Saskatoon, Saskatchewan, Canada, and there was a patient, an Indigenous patient in the critical care unit, or ICU, and that Indigenous patient's family wanted to use traditional Indigenous medicines, so they brought in a healer from their community, and the nursing staff and the senior administrative staff of the hospital were very supportive of that, and they wanted to honor these practices and give the family what they were searching for. However, in most, I would say, if not all, Indigenous cultures across Canada, we have a teaching called moon time. And moon time is someone's menstrual period. So a person with a uterus who menstruates will have their moon time once a month, or less frequently if they're on some other medication or IUD or contraceptive. But when someone's on their moon time, they should not be around, they should not administer, they should not use traditional Indigenous medicines, and they're also not even supposed to participate in some ceremony, because our teachings around moon time, well, they're very complex. And here I am as a cisgender male talking about an issue that's only for people with uteruses, but it's a very spiritual, energetic time, and it's taught to us that when you're on your moon time, you have an incredible energy, and your connection to the spirit world, your connection to the creator could be God in some people's beliefs, or some other name or person or entity, but your connection with the spirit world and with the creator overpowers the connection of those around you when you're on your moon time. So if someone was on their moon time and attending a sacred ceremony with others who are not on their moon time, it would impact those other people's ability to connect with the spirit world during those ceremonies. So in the context of this ICU setting, the family and the healer mentioned that nobody on their moon time should be, around or handling or administering these traditional medicines. But the manager, the nursing manager in the hospital, which are Western folks or non-Indigenous folks in a Westernized system, said that, well, we can't ask our nurses if they're on their period or their menstrual cycle, and nor can we guarantee that you'll have a nurse at all times who is a male or someone who does not have a uterus. So that was just one example how the system and its structure and its policies were inherently anti-Indigenous. Because in an Indigenous hospital or in an Indigenous healthcare facility, moon time would be foundational to the setup of the system, and it would just be common practice that someone on their moon time would not be handling medicines. So here we are as Indigenous people in a Western structure of healthcare, and it's racist. It's anti-Indigenous, even though perhaps each individual is not racist and each individual was not saying, I hate Indigenous peoples or you should not use these medicines. They as individuals were all incredibly supportive, but it was the system and the structure that didn't allow for that integration and didn't allow for the practice of traditional Indigenous medicines within that Western confine.
And in Canada, do you have any specific course or continuing medical education for Western people who are unaware of such importance? I would say I don't know if they done that on purpose. Probably they are unaware that women during their moon time and I fully understand that because the energy is totally different. So any chance for Western people who grew up in a Western environment and who have absolutely no idea that people can understand or interpret or perceive the world, the exact same world, but within their own belief system? Because I would say that that's the same for other religious tradition where a male can't be alone, treating alone a female patient. We need to adjust. So any specific courses for that in Canada or everywhere?
Yeah, and I mean, some of that training and education I offer myself, but such training and continuing education would never be provided in a way that, shares the intricate and intimate details of an Indigenous practitioner, for example, a medicine person or an elder. What we might do is just share some, bird's eye view type of information about our cultures, our worldview, our practices, our ceremonies, and then people at least have that baseline type of understanding. There's also something to be said related to the question you just asked about identity and upbringing and relationships and ancestors. For example, I'm thinking of a white person I know. He's not Indigenous by blood, but he was adopted by a First Nations family at the age of 6 months old and grew up on reserve with an entirely Indigenous family and community around him. So his heart, his mind, his spirit, is Indigenous because that's all he knew. But by blood, by physicality, he's not Indigenous. So that created a really interesting conversation around what can non-Indigenous peoples take up can there be a complete understanding and appreciation for indigeneity and Indigenous practices if you yourself are not Indigenous? And I think, yes, absolutely you can. It just comes down to your teachings and learnings over your entire lifetime. I don't think that attending a handful of lectures or continuing medical education would lead to a complete, wholesome understanding or appreciation, but it would absolutely give something more than nothing. And I think that that something is so important as it relates to creating some level of understanding and finding like a common ground to communicate with one another and understand one another in the same way that I have learned about something like Ramadan over the years, for example. I knew next to nothing. I still know very, very little, but I do know some pharmacy-related implications of Ramadan or other ceremonial time periods where people fast, for example, or don't eat. So, I, as a Western-trained pharmacist, would then say, well, don't take your insulin during that day, because if you're not eating at all, you're going to be incredibly hypoglycemic. I don't know enough about Ramadan. I don't practice Ramadan, but I'm able to have a conversation and identify issues, let's say, between someone's health and their spirituality or religion or ethnicity in that way. And I myself am not a person who practices or observes Ramadan. So I do think that, yeah, non-Indigenous peoples can learn a little bit or a lot and do a much better job in working with Indigenous peoples than they would without receiving that education.
Thank you, because that's very tricky thing for me, because I've received Western healthcare training as well. And today we are talking about two key concepts. One is the person-centered care, and the second is evidence-based medicine. And one pillar of evidence-based medicine is to know about patients' values and expectation. So to me, who is familiar with both Indigenous tradition and familiar with Western tradition, that implies that person-centered care, the practitioners needs to understand his patients' worldviews, and maybe it's not shaped within the Western worldviews. And at least this is in my profession, in osteopathy, this is very problematic, because there are people who just simply are unaware of all those Indigenous tradition. So is this something common? I would say, when we talk about patient-centeredness, to what extent is it centered to the patient in a Western healthcare environment?
In fact, I think that those conversations and practices around person-centered care or family-centered care, community-centered care is exactly the place where indigeneity and Indigenous tradition and Western practices meet in a really beautiful way, because although that person-centered care concept was birthed through a Western lens and through Westernized practitioners, what the spirit of person-centered care is has a really wonderful blend with indigeneity. So when I talk about person-centered care or shared decision-making in the context of pharmacy practice, what that's all about is I'm basically a facilitator in those situations versus a director, right? So I would, have a conversation with the patient, like, how does this sound? Or what do you think about this? Or if you were going to achieve XYZ, what would it take for you to get there? And they tell me, right? Of course, I can provide information and education about Western practices and medications because I'm a pharmacist, but I can also open up the floor for them to share whatever they want to share. And so part of that comes down to creating a safe environment where people feel like they can share those pieces about themselves or what they're interested in. I think that over time, many Indigenous folks have been ostracized or penalized or even abused or harmed or put in jail because of our traditional practices and medicines. So there still is a certain level of not sharing that information when we talk about person-centered care. But I think that if the healthcare practitioner, a pharmacist in this example, opens up the interaction and develops a relationship with a person in a way that is non-hierarchical, non-judgmental, safe for that person. I think that sometimes people might assume that if they share something bad, or they share that they buy drugs on the street, let's say, that I'm going to now go call the police or something. But no, that's not my job as a healthcare professional. My job is to provide healthcare, no matter who you are or what you do or what you take or what you don't. So I often share things just in exactly that way with people, like, hey, this is who I am, this is what I know, and this is what I don't know, and this is how I can help you. So let's have a conversation. And I think that that conversational type of approach versus a one-way or unidirectional type of approach that we often see has a much better blend with indigeneity. That's how we develop relationality and relationships with people, of having that two-way street of communication that's based on a relationship and not based on an interaction. So it's not just about simply having a doctor appointment and going to the doctor. It's having an appointment with Dr. So-and-so, and you're going to go there and have a conversation versus be told what to do. So yeah, person-centered care, patient-centered care meets really well with Indigenous practices.
Great, thanks for all those explanation. And if we go back to this body, mind, spirit principle, how is the spiritual dimension in healthcare used in the Western context and Indigenous context in Canada?
Yeah, so the spiritual context or the spiritual realm in the Western context, I would say, is almost not even there at all. I think that probably folks know that it's out there and that people do practice spirituality and religion, but it is absolutely not part of medical training or pharmacist training or nursing training. We might talk about the fact that people do practice various religions and spiritualities, but we don't learn about them. We don't take a world religions class, for example, in westernized health disciplines. But that's such an important realm, because taking an Indigenous worldview into the context of healthcare, something that lots of folks are somewhat familiar with is the medicine wheel, which is some people would recognize it as a circle with 4 quadrants, right? Each of the colors of those quadrants is very intentional, with white being north, yellow being east, red being south, and black or blue being the western direction. Each one of those colors and directions represents a stage of life, part of the world, dimensions of your spiritual, mental, physical, and emotional health. So the way I see healthcare broadly is that each one of those dimensions is so important and required for that circle, for that wheel, that medicine wheel, to keep turning, right? And if you picture that medicine wheel with those 4 quadrants as a wheel, what happens if one of those quadrants starts to deflate or overinflate? Well, that wheel's not going to turn anymore, right? You're going to have a really bumpy ride. So from a Western point of view, where we don't talk about or intervene in the spirituality realm, we're kind of contributing to overinflating or deflating people's wheels, if that's something that you practice. So for me to be a fully healthy, well Indigenous person, I must practice my spirituality, and that's something that I get outside of the Western system. So I don't go to a pharmacy or a doctor's office to participate in ceremony, right? I have to go find an Indigenous practitioner or an Indigenous space to ensure that my wheel is perfectly balanced and can spin and turn and operate in a way that that I'm healthy and that I'm well and can get on with my days.
Here in France, the spiritual dimension in healthcare belongs to only one clinical guidelines, which is the end of life care to alleviate pain and suffering, and to allow people to give sense, to give meaning to what was the life, the end of their journey. So I think we're reaching the end of our podcast. Would you have any additional comment for or different people around the different parts of the world?
Yeah, just like thanks for listening. Thanks for spending some time and investment in learning. And I encourage folks to always stay curious. I think that if we stay curious, then that will lead us to asking the right questions and seeking out the right resources, versus not staying curious and not engaging in learning about others. I think that's more of a actually potentially dangerous place to sit if you're not curious and don't spend the time learning about others. For folks like myself who work in a health discipline like pharmacy or medicine or otherwise, we care for people regardless of their ethnicity or spirituality, and anyone who's anyone can come to us. And if we don't know enough about certain groups of people, then our treatment is going to be kind of lopsided. I might actually provide better care to westernized folks whose upbringing and values and beliefs match up with the Western system. But if that's not you, then the care I'm offering is not going to be, the same extent of good as it would be for someone who does come from a Western background. So the more we learn about each other, then the better the care experiences will be from both the provider and the patient and family and community perspectives.
Thanks so much for sharing your wisdom with us and for giving you inputs on what indigenous people are, what type of medicine, and how is it possible in different environment to combine both wisdoms, not only, and for both people, both from the Western part and from the Indigenous part. So that was very inspiring chat. Thanks so much for being with us, Jaris, and have a good day.
Yes,
Bye.
thank you so much.
And
thanks for listening to the BMS podcast. We hope you've enjoyed your chat today. BMS Formation is working to bring more compassion and tolerance between people holding different worldviews in healthcare and beyond. Share it if you like it, and see you soon.